Good evening, doctors. Welcome to another Simply Nature Doctors Forum. We want to welcome our existing doctors and also doctors and medical practitioners who are joining us for the first time. Last month, our topic was breakthroughs in chemotherapy support. We were scheduled to do a topic on our breakthrough protocol for atopic dermatitis, and we will still be having it in November or December as we need to accommodate the schedule of our special guest speaker, who is also the researcher behind the breakthrough. And it's really such a breakthrough that we want to keep her a mystery until her schedule is confirmed. Well, tonight we are going to review a very important topic, the treatment of colorectal cancer. Last month, we got feedback and poll results from our webinar. So we're just going to let you know that 100% of our participants last month were keen to explore how they can work with chemotherapy in conjunction with their existing protocols for cancer. And more than 50% of our participants had cancer patients who are currently or have had gone through chemotherapy. So actually, Simply Nature's PPAR series is really important for your treatment protocols. So tonight's discussion, we will be covering chemotherapy in conjunction with colorectal cancer again. All right, so our structure for tonight's discussion is like this. First, we will talk about an overview of colorectal cancer. Next, we will discuss the common treatment protocols, conventional treatment protocols, and natural therapy treatment protocols. And we will weave in how do we actually use Simply Nature PPAR products like our extract series together with the natural therapy and with the chemotherapy, the conventional therapy. All right? So let's jump in right now and take a look at an overview of colorectal cancer. Now, based on 2018 statistics, colorectal cancer globally is the third most common diagnosed cancer for males. And it is the second most common diagnosed cancer for women. The latest numbers might be a little different from this, but it won't change the very important fact that colorectal cancer is one of the most frequently diagnosed cancer for both men and women. So tonight's topic is really relevant to the patients out there. So we'll do our first poll for today, all right? How many percent of your current cancer patients are actually colon cancer patients? It's gonna pop on your screen right now. Just give us a quick estimate. So is it 25% or less, 50% or less, 75% or less, or more than 75%? Are you specializing in colon cancer? So this will help us understand how we can support you. And also it's very interesting to see the statistics, right? Okay, now let's go back. Thank you for the polls. We will announce the results during the Q&A portion of tonight's discussion. Let's review the key characteristics of colorectal cancer. And here I would like to acknowledge Dr. Johnson for his input and his discussion. Okay, let's take a look. Key characteristics of colon cancer and its implications. There are three key characteristics that we want to take a look at. Number one is, although there are many numerous forms of colon cancer, in general, colon cancer is a relatively slower growing cancer compared to other cancers such as lung cancer. So this has an impact on our protocols and strategies. Next, they are often diagnosed in their early stages. So unlike other forms of cancer, colon cancer is more often diagnosed in its early stage compared to other cancer. So in fact, let's do our second poll right now, very quick. The second poll is, for most of your colon cancer patients that you are treating now today, what is their staging? Are they stage 1, stage 2, stage 3, or stage 4 colon cancer patients? Based on statistics, most colon cancers are diagnosed in their early stages. So I think it'll be interesting to see for today's participants, your cancer patients, when they first came to you, what stage were they at? All right, for stage 1 colon cancer, chemotherapy is not even recommended as a standard protocol. In fact, colon cancer is one of those few cancers where the oncological prognosis can be wait and observe. So really, because it's a slow-growing cancer and it's often caught in the early stages, there is even their wait and observe approach is even applicable. All right. So let's go to the final key characteristic that we just want to discuss today or bring up, which is surgery. Surgery is the most common and decisive action for colon cancer and suspected colon cancer. So simply have the polyps removed, right? That is the simple approach to colon cancer or suspected colon cancer. Now, taking into consideration the three characteristics that we've discussed, what are the implications? Taking characteristic number 1 and 2 into consideration, it provides us with the most valuable commodity in fighting cancer, and that is time, all right? Time. And also that the cancer is actually diagnosed in its early stages. This means that the cancer can be observed, protocols can be applied. The fact that the colon cancer is often resolved with surgery and short preventive chemo sessions means that it opens up many opportunities for integrative doctors to work with patients. Okay, what does this mean? It means that because colon cancer is slow growing and is often diagnosed early, there is an option for patients to go for a PPAR liquid and observe it for a month to see if the tumor polyps would decrease in size using SimplyNature protocols and in addition to your protocols. And if it does, great news, we can continue. If it does not, and the patient wants to move forward with surgery, using SimplyNature PPAR extract series will actually prepare the patient for surgery, boosting their immune system, lowering his blood sugar levels, modulating his inflammation overall. So basically, it's a fantastic pre-op prep. So there's no lost opportunity for us to prescribe SimplyNature PPARs extracts. It will help the patient regardless of whether they're going to go through their chemotherapy surgery or not. All right. Now that we've taken a look at the three common characteristics of colon cancer and their implications, let's really now take a look at how colon cancer is most commonly treated and how integrative practices can come into play to support and work in tandem with conventional medicine. So we'll start with conventional medicine. The primary conventional approach to colon cancer is actually surgery and chemotherapy. Even surgery options for early stage colon cancer is often followed up by short cycles of preventive chemotherapy. Once the colon cancer goes into metastasis, chemotherapy becomes a staple as with most forms of cancer. Now let's take a look at how you can work with colon patients who are undergoing conventional chemotherapy. SimplyNature series is perfect complement to colon cancer patients undergoing chemotherapy, conventional treatment, chemotherapy treatment, surgery and chemotherapy, right? Let's take a case study as a reference for our discussion. Here is Mr. Low. He's actually a retired major in the Singapore Armed Forces, and he was diagnosed with 3rd stage colon cancer. He had part of his colon removed, after which they found that his colon cancer had metastasized into his liver, and he had to have part of his liver removed too. So he underwent both surgery, removing his colon and liver, and he also went through chemotherapy as well. Now, he started to take SimplyNature PPARs protocol in preparation for his chemotherapy, and this is what he said. So I want you to hear it straight from the patient's mouth.
3 months after my liver surgery, um, I had an MRI scan, and the doctor told me that the liver growth is progressing well. So after that, I still continue to take PPARs. Now it's both powder and tablet. Tablet intake I increased to 20 tablet a day. And when you take the PPR tablet, you have to take it with warm water, normal temperature water, slightly warm. I feel so much better when I take it with warm water. 3 months after my liver surgery, doctor told me to get some fresh air, let the body exercise more. It was early morning. The time my wife accompanied me 5:30 a.m. for morning walk, about 3 kilometer, 3.5 kilometer park in the morning, and in the evening on my own. I also did that. So buy some light exercise at the park. The 6 months after my liver surgery, I went to play golf without telling my doctor. My hand was very itchy, so I can't go away from the golf course. So I started playing, and also was taking my PPARs faithfully. When I started to play golf, I found that I have lost strength in my game. And I started to play twice a week. Slowly, week by week, my strength improved. I'm not sure whether it is due to my willpower or to the food that I take. Still continue to take my PPRS every night. The time my powder then off, so I start to take the capsule. And after the capsule ran off, the tablet, switch back to tablet. Consume about 20 tablets. Always told my wife, where is my kacang putih? We just take one handful without counting, pop it in the mouth, some warm water just before I sleep. The important thing is I find that it is very helpful. I eat just before I sleep. When I wake up, I found that it is different, much better. Don't have tiredness in myself. That's why I can wake up early morning to go for morning walk. So until today, I still continue to take this PPRS tablet. Oh, the report in April, 6th of April, doctor told me everything is fine. I did not find any cancer cell. Everything improved. So the thing is that I want to maintain my good health, and I still continue to take PPRS. What you read, what you see is just a belief until you have gone through it. Just like my initial reaction to PPRS when I read the report, when I went on the internet to do a search before I consumed the thing, said, where in this world do we have such a good medicine? I don't believe it until now, and I'm completely so-called cured of cancer because of PPRS.
So as you can see, what a wonderful testimony and what wonderful case study to show that patients who undergo chemotherapy, how they can benefit from our products, especially our extracts. So Mr. Low did not feel tired. He did not experience the common side effects of chemotherapy. In fact, he had good appetite and he even gained weight. And he did not lose hair. In fact, his white hair dropped and black hair was growing back. And this was during chemotherapy. Now, Mr. Low also had a portion of his liver removed, and it was amazing at the speed at which he recovered. Even his doctor was shocked by it.
3 months after my liver surgery, I had an MRI scan, and the doctor told me that the liver growth is progressing well. So after that, I still continue to take PPRS. Now it's both powder and tablet. Tablet intake I increased to 20 tablet a day.
Now you can see the amazing testimony and case study of Mr. Low is that not only did he recover fast from the operation, and that he was doing well, very little side effects from the chemotherapy because he was on SimplyNature PPARs. And this is true because Dominic, who is a 4-year-old cancer patient, nose cancer patient, he went for extensive chemotherapy and radiation therapy, and he also experienced very little of the side effects of chemotherapy when he was on the liquid extract in tandem with his chemotherapy sessions. But I think we're not going into detail for that because today we're going to focus on colon cancer. But it goes to show, again, that our products, our SimplyNature products, are fantastic in protecting patients in chemotherapy. Okay, Mr. Low's case study shows that we are very effective for pre-operation prep and post-operation recovery. Now, after surgery, it is common for oncologists to prescribe preventive chemotherapy. And here, Simply Nature protocols are very effective. So I want to take a closer look at the science behind why it's so effective for chemotherapy. Okay. Oxaliplatin is the standard go-to chemotherapy drug for colon cancer. And here's the good news. The good news, and what will give all the doctors here tonight confidence, is that Simply Nature has actually tested our products with oxaliplatin. Specifically, we tested it with chemotherapy drug oxaliplatin, and we're talking about colon cancer today. And oxaliplatin is the standard go-to chemotherapy drug for colon cancer. So let's take a look at the following two slides. The first slide shows that patients do better with Simply Nature liquid extract during chemo, specifically oxaliplatin, as you notice. Notice that the body weight remains normal. The green line compares to the pink line. For regular oxaliplatin, the case study loses about 10% of their body weight in 4 days. But you take a look at a co-treatment, which is the green line, co-treatment with Simply Nature liquid extract, you can see that the patients fare much better. The body weight stays normal. Although prolonged chemo sessions will still cause patients to lose weight, but at a much more gradual and less alarming rate. So that's good news for all patients who are going through chemotherapy. The next slide is even more important. Take a look at this. Oxaliplatin has a rather worrisome side effect. It damages the bone marrow cells. As we all know, bone marrow cells are where the precursors to your immune cells are produced. If the bone marrow cells are damaged, the immune system is compromised. What's important to take note is that for your protocols to strengthen the patient after chemotherapy, it will be severely limited because of the bone marrow cells being damaged. So vitamins and supplements that you prescribe to your patients will be less effective. I'm sure you have all noticed, right? Patients who have undergone chemotherapy respond less well to your dietary and supplemental protocols compared to patients who have not gone for chemotherapy. Surgery is a very common first approach, and after surgery, many oncological surgeons, surgical oncologists and oncologists will still recommend preventive chemotherapy. And after their chemotherapy, they will be a perfect patient for you to nurse them back to full strength. They will often come to see integrative doctors for wellness advice and to get back into full recovery. Here with Simply Nature PPAR extracts, Simply Nature extracts, you can now work with the cancer patients during his chemotherapy, and after the chemotherapy, when he comes to work with you fully, your protocols will have fantastic, better effects because our product protects bone marrow cells from cytotoxicity, from damage from chemotherapy. And not only the bone marrows cells, but also the spleen as well. And that's where the patient's immune cells are actually stored before they're released. So overall, if your patients are on Simply Nature extract liquid or powder during chemotherapy, they will do very, very well. Now let's go into the specifics of the protocols for colon cancer patients. For chemotherapy support, let's start with chemotherapy support. The best chemotherapy support that Simply Nature offers is our liquid extracts. All right, so take the Simply Nature liquid extract, 1 to 3 vials a day together with Simply Nature PPAR micro tablets 3 times a day, and cleanse to keep their bowel movements regular, because that's very important. So that's the best chemotherapy support. Now for basic chemotherapy support, in case patients are financially challenged and they have a more limited budget, the basic chemotherapy support will be the soft gel capsule. All right, 1 capsule 2 to 3 times a day together with Simply Nature PPAR micro tablets, 15 micro tablets 3 times a day, and of course cleanse to keep their bowel movements regular. Now you will notice with all our protocols with the extracts, whether they are liquid, powder, or soft gel, we will always pair it up with the micro tablets, the SimplyNature PPAR Plus micro tablets. The reason is because the micro tablets are very important for patients as a nutritional support. You can get, and patients, once they get cancer and the side effects of cancer treatments, they are usually nutritionally deprived. So there is no better supplement than our micro tablets. And many oncologists even encourage cancer patients to take meat. And I know to the integrative doctors, to the lifestyle doctors amongst us, this is like a huge no-no. But the reason is because meat is actually aggravates the cancer condition, right? Now, but however, the oncologists are prescribing meat because the patients need a high protein intake. They need a rich source of protein. And that's harder to come by with plant-based diets. The good news is that our SimplyNature PPAR micro tablets is 60% plant protein, 60% plant protein. And it's a great dietary supplement for cancer patients. In fact, we encourage our cancer patients to take as much as micro tablets as they can, especially if they don't have a good appetite. They should take more tablets because it's easy to consume. They just swallow. They don't have to really eat, all right? And yet they will get all the nutrients that they need. Okay, now let's take a look at actual early stage protocol. Like we said, colon cancer is often, diagnosed in its early stages. So even if they're going for conventional medicine, if they want to boost it, again, they can try to reduce the polyp size naturally to possibly avoid surgery. Okay, so this is a pre-op prep. So if a diagnosed early stage colon cancer patient is probably going to be scheduled to have his polyps removed, to have the tumor removed, right? And as the integrative doctor, you can advise and work to prepare them for the operation. Because what's really important is normally patients being Filipinos, right? Most likely they have high blood sugar, blood cholesterol, and general inflammation in their body. So they actually need to be prepared for operation. And since colon cancer is not so aggressive, scheduling a operation 2 weeks, 3 weeks down the line is not something that's unreasonable or risky to the patient. So there is actually at least a 2-week window for the patient to be able to prepare himself for operation. And of course, if the patient is diabetic, then all the more there needs to be a pre-op prep. So the protocol for pre-op prep is for best results, again, our liquid extract, 1 to 3 vials a day together with our SimplyNature PPAR micro tablets and cleanse. Now, with the liquid extract, there is a very good chance that the polyp or the tumor, if it's a benign polyp, but they're going to go for surgery anyway, or if it's a early stage cancer tumor, there is a strong chance that the polyp and the tumor may actually start to shrink on its own because it's early stage cancer. And that chance is increased greatly when the patients use our liquid extract. So before they go for the surgery, they could do another scan. And if the polyp or tumor has shrunk in size, then they now have an option, a non-surgical option that they can pursue to see if they can really remove the polyp and the cancer tumor completely without surgery. Okay. So, but for basic protocol for such an approach would be the powder extract, 1 to 3 scoops a day together with a micro tablets. But for the best results, if patient really wants to try to avoid surgery, then the best bet would be to use the liquid extract. Now that we've covered the conventional protocols, let's now move on to the natural treatment protocols. The most common natural protocols for colon cancer is really dietary change and supplements to boost the immune system. Other protocols include IV vitamin C, ozone treatment, and others. I just want to thank Doc Maddie for sharing and confirming some of the protocols that integrative doctors use. Okay. Now, SimplyNature extracts are on a very different level from general supplements and dietary supplements because we are specifically, because we specifically do clinical research and trials for the treatment of cancer. So unlike your standard, for example, taking vitamin C, vitamin E, vitamin D, zinc, all these enzymes, which are all great for immune system, our products are on a different level because not only are we proven to be great for the immune system, we actually went the extra step to do testing on cancer patients, on cancer cells, on chemotherapy, on actual chemotherapy drugs like oxaliplatin, like cisplatin. So we are not just like the other supplements that are good for the immune system. Our supplements, we actually conduct research to understand how it works specifically for the effect of fighting cancer. All right. In summary, we not only research and proven effective for cancer, or fight against cancer, we have also done clinical research and trials for the management and treatment of the causes for cancer. All right, so things like metabolic syndromes, which are like the precursors, the foundations of cancer that over time will develop into cancer. We've done clinical trials and proven to be effective for the management of blood sugar, blood cholesterol, so cardio issues, inflammation, all these. We have all the medical journals published specifically on our Simply Nature products to show that. Our extracts are also effective as liver and kidney aids, and this provides a holistic approach to the treating of cancer by supporting important functions such as detoxing and managing inflammation. All right, so in summary, our products are clinical research and tested for cancer and for precursors and causes of cancer, and we provide a multi-organ holistic approach to helping the patient fight cancer. Now, I just want to take a little bit of time just for the doctors who are new to us to go in to take a look at how SNI protocols actually work to fight cancer for natural therapy. All right. Number one, our Simply Nature extracts are gene activators. So they activate pathways that regulate the following key systems in fighting cancer. All right. Number one is the immune response. It's very important. Our pparrs activates the pathways that regulate your immune response. It activates your dendritic cells and also the maturation of your naive T cells to Th1 cells. So just take a look at this following two slides. Okay, the first slide shows the dendritic cell regulation of Th1, Th2 development. So you can see how our products will actually stimulate and cause the dendritic cell regulation of the maturation of naive T cells to become Th1 cells. All right, and here on the next slide here, you can see the pathway. So like I said, we activate, it's a gene activator, and it activates the pathway that regulates your immune response. All right, now the Th1 derived interferon gamma is shown to render macrophages directly cytotoxic to cancer cells and to induce macrophages to secrete angiostatic chemokines, all right, that attack the cancer cells directly. So in conclusion, our gene activators that activate the immune response pathways increase the dendritic cell activity, the T cell activities, the macrophage cell activities, which really boost and increase the body's ability to fight cancer tumors. Here's a simple picture that we always show of how, in summary, the Simply Nature protocol actually fights cancer in 5 ways: strengthening the immune system, cell growth arrest, starve cancer cells, reduce inflammation, and potentially minimize metastasis of cancer tumors. Okay, now we're going to finish very soon. Just a few, 2 or 3 more points, a few more minutes, and we're done. And we'll move into the segment which I'm sure all of you will be very interested in, which is the Q&A. All right. Okay. Now, our SNI extracts and protocols have also been proven effective for managing blood sugar and blood cholesterol levels. And we all know those affect the development of cancer. And so you can't just treat cancer without also treating the underlying conditions. So most cancer patients might be suffering from diabetes, they might have heart conditions, they might have hypertension together with their cancer, and it just makes the whole treatment more difficult. Now, the good news is that while you are prescribing Simply Nature extracts to the patient for cancer, at the same time, the extracts are going to work to manage their blood sugar levels. It's going to work to bring their blood cholesterol and cardio issues into control and bring their general level of inflammation down. So the patient is really going to benefit on multiple levels, and it's going to make their fight against cancer all that more effective, and your other protocols that you normally prescribe to your patients more effective, because the other underlying illnesses are also being targeted and treated at the same time. Okay. Finally, our products are very effective kidney and liver aids. And this is so exciting. This is so exciting. It just came in last week. I had a catch up with one of our doctors, and he was sharing with us a very exciting case. I think in the past I've shared before that we've had patients who are on dialysis, that once they started to take our Simply Nature extracts like the soft gel, powder, and liquid extracts, they actually go off dialysis. Last week we had another confirmed case with one of our doctors. It's very exciting. So the patient's lab results indicated that he required dialysis, and this was just last year in December. And the patient went on to our soft gel capsules. And before the lockdown actually happened this year, the patient's results were already very positive. I believe, and today the update is that the patient no longer needs to go for dialysis. His kidney has really improved and is starting to come back to normal levels. So you can see how our products really help the kidney and liver. And these are so important because when our cancer patients have weak liver and kidney functions, there are many complications that can come. And it makes all the natural and conventional protocols less effective when patients have trouble with their liver and kidneys. Okay, so now let's take a look at what is the protocol for natural therapy. If the patient has chosen to really just only use natural protocol, no chemotherapy, maybe they want to go for surgery, but they don't want to do chemotherapy, then this is what the protocols will be. For stage 1 and stage 2 cancer, colon cancer, start with 1 vial of liquid extract a day to initiate the gene activation, to start to modulate and initiate the immune response pathways, right? And this is to be paired up with the SimplyNature PPAR Plus micro tablets, 15 tablets 3 times a day, and take a cleanse a day just to keep the bowel regular. And because constipation is such a common side effect for cancer and cancer protocols. Okay, after 10 days of the liquid extract, you can observe, because it's early stage cancer, you can switch the patient to our more economical extract powder if they cannot maintain themselves financially on the liquid extract. All right. And just after that, just keep monitoring the patients, go for scans, and to observe the size of their cancer tumors. It should be shrinking, and their cancer markers should be coming down. Patients often ask me, they don't ask the patients that we deal with directly. Obviously, our doctors answer their patients. But when I get to meet our cancer patients, they often ask me, how long do they need to stay on a product? And the answer is actually quite difficult to pin down. Unlike chemotherapy, where, for example, oncologists will prescribe them 12 cycles, right? But even then, it's not for sure, right? After the 12 cycles, they might not go for another few more cycles. So the answer is that we really need to observe from patient to patient. What's important to know is that this is both a quantitative and qualitative treatment protocol. That means patients should see improvement, right? If they don't see improvement, it does not make sense to carry on with the protocol, and maybe they need to explore other options or increase the strength of the current protocol that they're using. Now, if they are seeing results, then we're doing the right thing. Keep doing it until the cancer is in full remission. And then after that, you can actually use Simply Nature protocols like the soft gel tablets, soft gel capsules or just even the tablets to maintain and keep the immune system up and running so that they don't have a recurrence. All right. Now, for stage 3 and 4, our protocol will be 2 to 3 vials of liquid extract a day. Okay, together with the SimplyNature PPAR Plus micro tablets, 15 tablets 3 times a day at least. All right, and with cleanse to help them maintain regular bowel movement. Now, the doctor can substitute the liquid extract for 2 scoops of extract powder 2 to 3 times a day instead for patients that are really financially challenged. In fighting cancer, the finances is an important, I guess, limitation and consideration for the treatment of cancer as well. Okay, let's make sure that there's better lighting. Okay. However, if they move to the extract powder and the results are not as good as liquid, then obviously they will then need to move back into the liquid so that they will get back the more effective results when they were on the liquid. So this is really a case-by-case basis. So I guess it's really important to do diagnostics, to check, to do regular scans to see how the patient is doing. And I'm sure you will have your protocols for that. Okay, so I want to summarize. I'm pretty much done with the standard structured presentation, and we will move to the Q&A. So in summary, SimplyNature extracts are important and effective part of your protocols for both conventional and natural colon cancer therapy. Okay, so now that I've finished the structured discussion, I'm sure you have questions. So let's move to the Q&A portion of tonight's program.